Psychologists have Reddit. What's one thing a patient has told you that caught you off guard, or vice versa? Patient's perspective? During my first and only session with a particularly memorable child psychologist, he referred to me as a miserable bitch. It was true, but he didn't have to call me out like that. I was in a psych hospital as a teenager. While all the patients went to their rooms to do homework or whatever, the mental health techs, nurses would do their shift change. They'd have a meeting to update the night shift on how the patients were doing and anything that happened earlier in the day. My room was right next to the kitchen, which was where the meetings happened. One day, my door was slightly open and I decided to listen in on the meeting. The first thing I hear is the main tech saying, "Vector Abd, Sai, he's a mess." I never held it against him, because I knew it was true and he was a really good guy, but it was a little shocking hearing it said so bluntly. It's definitely funny in hindsight. I was in the ED after a suicide attempt and heard the nurses' shift change meeting too. They said that girl in bed 6 did it to herself. Don't waste your time there. I mean, it was true. But frick me, nobody ODs and carved up their arms, because it's a boring afternoon. Suicide attempts generally mean you're not very well mentally. That's royally fricked up. I think people who say that are privileged to have never felt suicidal in their lives. I'll never forget my first day of therapy. My therapist asked me if I had ever been abused as a child. I replied, no, I had a normal childhood. I had everything I needed: food, shelter. I mean, my mother slapped me and would tell me to kill myself, and my dad would drag me by the hair everywhere and pull my hair out. But no, nothing abusive or anything. There was at least 30 seconds of dead air between us as I watched her blink while trying to figure out how to respond to what I said. Eventually she put down her file, crossed her legs and said, "My dear, that is abuse." My world came crashing down all around me at that moment. For so many years I had buried my feelings about what they'd done so deeply that I'd managed to convince myself that what they'd done wasn't wrong. Less than a year later I was diagnosed with PTSD and panic disorder from the trauma, and I cut off all communication with my parents. I had something similar. She asked me if I had a happy childhood. I said yes. Then she asked if I would want to relive it again and I said, yes, of course. I would love to revisit my childhood knowing all I know today. I would do so much things in a different way. She said, no, I meant, would you relive your childhood exactly as it was, without knowing what you know today? I burst out laughing, saying that of course not. Noon would ever choose to do that. That's when I realized that I had a pretty itty childhood and a terrible family, and that the therapy wasn't going to teach me how to change who I was, but how to process all this. I kinda had the same epiphany. I was self-harming and was actually abused by someone outside of the family. I always thought those two things were connected, until my therapist asked me, if your mom wasn't your mom, how many scars would you have? What percentage? I, not really thinking too hard about it, said dunno, maybe 10%. He just stared at me while I began crying. That was the moment it hit me. Hit me a little hard though. Felt suicidal and guilty about it for another 6 years, but eventually I cut contact too and I'm loving life right now. It's beautiful. Had a therapist tell me to make a frick budget. Hear me out, LOL. He said you only have so many fricks to give before you blow, so just like with money you need to budget it out. Start with things you have to give a frick about: kids, work, health, and then cross the things you dislike giving a frick about, like people's opinion of what you wear, off the list and don't give a frick about that. This was an older gentleman who was cool, but for the most part very well spoken and didn't cuss. Hearing him say I needed to stop spreading my fricks so far made me die of laughter and immediately feel better. To this day I still have a frick budget that I do every month religiously, and it has taken so much stress off my shoulders. This is one of the greatest things I have ever heard. I had one tell me I needed to learn to bite the bullet, which turned out to be good advice, even if it was blunt. Sometimes it happens and truly the only way to get through it is by moving forward. As you said, it can be blunt, but it is the reality sometimes. Seems like most of life's problems can be solved by saying frick it. Please stay away from me and my pets. So, as a practicing clinical psychologist, I've got to comment on the bad, crazy, unprofessional behavior being posted here. If this happened to you, complain. I say fully recognizing that some may be left feeling disempowered to do so, which is horrible. If it's a licensed clinician, report it to the regulatory body. That's one of the reasons they exist, to address concerns of the public. If they are not, or even if they are licensed for that matter, but they work in a group practice, then speak to whoever has their name on the letterhead, e.g., the clinician whose business gets hit the most by lack of business related to this stuff. Period. They may be quite thankful to know and can take steps to prevent this from happening again. This can vary by region, country, so may not capture everywhere, but can be a useful starting point. The words counselor or therapist, psychotherapist are not necessarily reflective of any advanced training. Titles like psychologist, psychiatrist, or social worker are legally controlled titles, meaning they are issued and monitored by licensing bodies who ensure us people are qualified to do what we say we can do. Examine the hell out of us before they trust that we can, and act in the interest of the public to make sure that if we step out of line we either get hauled back in with anything ranging from education to even perhaps getting kicked out of the club. In other words, the title comes with accountability, the former may not. Not saying that therapist Bob or counselor Kathy are inept, more about being aware of what you're investing in, and that one of the reasons our licensed behinds were in school so long was to become overly familiar with, and invested in, proper boundaries, ethics, and applicable laws. Bob and Kathy may not be as hip to that stuff. Full acknowledgement, licensed title, and being taught this stuff does not mean unequivocally that the clinician has the sense to use the knowledge. There's it on the shoe of every profession if we're being honest. That being said, think of the licensing process and education as the yard of the home where someone has been hired to clean up the doggy minefield, thereby substantially decreasing the chance of a nasty Nike. Much empathy and positive vibes towards those who have had negative interactions like those described in the thread. Beyond sucks, and I hope you feel like you can give the therapeutic relationship another try in the future if you haven't already. P.S. What caught me off guard? Patient here. In response to me telling my therapist that I was prescribed Wellbutrin for my depression, anxiety, my therapist stated that it was a medication that a lot of adults with ADD see a positive effect with. It threw me off for a second and I was like, that's cool. Why do you say that? Therapist. Because you have ADD. Me? What? I do. Therapist. Yes. You present very typical ADD for adults. Me? Therapist. I thought you knew already. Me? Nope. But that explains so much. I also got a second opinion just in case and it turns out I absolutely am ADD. Thanks doc. LOL. I have been seeing my psychiatrist since I was 15. I just turned 22 and less than a year ago he put me on Ritalin for ADHD. I was like, I have that? And he said, yes, remember I had you take that assessment a few years back. Then he pulled out the assessment and sure enough I have ADHD. I asked why I just found out about this. He said I already knew, but he didn't see any reason for medication, because I wasn't struggling in school too much. Last year I started online courses for the first time since graduating and I could not for the life of me do the work. So he decided to put me on the meds and now everything is so much easier for me. I only found out I was formally diagnosed with autism at an early age when I was 18. I don't remember getting assessed and at the time self-diagnosis of Asperger's was in vogue. And I didn't want to be one of those people. But I'd been seeing psychiatrists twice a year, local law regarding psychiatric drugs prescribed to minors, since grade 2 for ADHD and other assorted comorbidities. It would have been nice getting proper treatment for my meltdowns at an early age. I have no idea why my psychiatrist at the time didn't explain it to my parents, though to be honest it's possible my mother didn't understand what the diagnosis meant and just forgot to follow up. I just assumed I was a bad kid who threw tantrums often. I had a similar situation. Getting my I have depression and fricked up PLZ let me try college again paperwork and doctor asked if we were going to include the ADHD, which, what? Basically got told you almost certainly have ADHD. Get tested. Forgot to get tested for almost 3 years, but apparently I have severe, obvious ADHD. I'd say forgetting to get tested for almost 3 years is itself a pretty valid test. When I was in high school I was hospitalized for being suicidal. My doctor there told me some really brilliant advice that totally cleared things up for me, basically just fixing me on the spot. You just have to be a normal boy. LOL. And to think that he gets paid for that at big bucks, too. He was the head honcho. LOL. Seeing him hang up a corded telephone was a trip. Bye. Bye 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 bye. Bye as he moves both his head and his hand towards the place where you hang it up. His head was basically touching the base of the phone when he was done. Then he pops back up. LOL. After 5 or 6 sessions I was about to schedule my next appointment when my therapist said she wouldn't continue seeing me because she should spend her time on patients who have real problems. I didn't see another therapist again for, like, 15 years. I'm curious, how old were you then? I had a similar experience when I was 14. The psychologist told me she needed me to see someone else because she went to a prestigious school and worked on high-profile studies of schizophrenia and bipolar patients, and since I was neither of those things, I was a waste of her valuable time. I'm 32 now and was just diagnosed as bipolar type 2 last year. It frustrates me to hell and back thinking that, if only she hadn't wrote me off as a moody teen and had actually paid attention, maybe I could have gotten what I needed so much earlier. I was 20-ish. She was a therapist at my university. She was also a PhD candidate, meaning she couldn't use you in her doctorate thesis. That's horrible for them to say. If they bother you, then they are real problems.